Welcome, and thank you for tuning into my channel. I'd like to give you the facts. This particular video, let's all be adults because of the fact that we are all human. A topic that is not really talked about much, so therefore thousands of emails over the last several years I have received pertaining to this topic. The topic is orgasm. First, I want to give you a little bit of better understanding about our spine. Our spine from the side should have three curves: a cervical lordosis, a thoracic kyphosis, and a lumbar lordosis. It should look like an S shape from the side. This is the way, ideally, it should be all the time. When people sneeze, they have a tendency to bring their body forward, to bring their head forward. What this does is puts in more intrathecal stress, more pressure within the disc canal, within the spinal canal, affecting those nerves and causing muscles to violently spasm and contract. The correct way to sneeze would be to try to sustain this normal position with the head slightly back or the lower back slightly back rather than going forward. So when people have orgasms, this involuntary contraction, as if you were sneezing, is fairly similar. And what people do is they have a tendency to put their head into a forward position, their body into an awkward position. That's where potential injuries arise. I had a patient, make a long story short, came in a few years ago, sitting down, his wife was out of town, and he was watching a movie, was about to climax. As the door knocked, he looked over, and by the motion of his head looking to the side and going through the orgasm, he violently sustained a serious neck condition. So I would just want to reiterate that the safest position to be in is close to an extension or near normal position, the way the spine is designed to be. And that is with a normal curve going inward like this rather than your head going forward, and a normal curve in your lower back as if you were going to lean back a little bit rather than going forward like this. So I hope that this gives you a little bit of a better insight, because having an orgasm can and will cause muscles to involuntarily contract, increasing intrathecal pressure in the abdominal cavity, causing muscles to contract and shorten. So if our head, which weighs approximately 12 pounds, is going forward, that weight becomes multiplied by 2, 3, 4, 5 times of the weight of the head. And if our body is going forward, the weight of our upper torso is being drastically increased, putting tremendous amounts of stress on the discs, if it's the lower back or the neck. So just that you are aware, you can experience significant disc or spinal-related conditions if you are not careful. I hope that you'll share this video, subscribe, leave your questions below. I'm sure you'll get thousands of people that will respond to you, but most important, we need to learn from each other. I ask you to make it a great day. I'm Dr. Alan Mandell.